My name is Doug Sheely. I've had both my neck and my back both fused, C3 through C6 in my neck, and L4 through S1 in my low back.
My name is Scott Schoenhart. I had a fusion from the C3 through C7 and also L5 to S1.
I'm Kathy Dunn, and I had a 360 lumbar fusion of the L5-S1 part of my spine.
In 2005, I had a rodeo accident. I was thrown from a steer. Can't feel in my hands, cramping, my legs cramping at night, not able to keep weight underneath me. After having a lot of problems with that, I went to a few doctors. I had an earlier surgery that fixed it for a while. After about 18 months, it came back and progressively gotten worse.
When I was 18 is when my problem was diagnosed, and really don't know how it happened. I was a gymnast when I was younger and very active. In college, I woke up one day after doing some gymnastics and I pretty much couldn't get out of bed. Eventually, the pain just kept getting worse and worse, and I was going to the chiropractor every 2 weeks. I wasn't sleeping more than an hour straight. I would wake up because my leg would be numb, especially my left leg would be completely numb.
My pain began back in 1984 following a helicopter accident. I had an anterior cervical fusion of C5 to C6 back then, and then not taking care of myself, doing activities that weren't really helping matters. I slowly started feeling more pain. Came to the point of where it was debilitating. I couldn't exercise, couldn't work out, couldn't ride my bike. I basically became a couch potato, gained a lot of weight, which that didn't help matters either. And it got to the point where I just couldn't tolerate the pain anymore. It was affecting my job.
Dr. Salinas seemed very confident to me, and he reassured me. He was able to explain the procedure in great detail, and he has information on his website that helped me to understand what he would do.
I was referred to Dr. Salinas and Frisco Spine from my chiropractor. Dr. Salinas is fairly new in the Metroplex, and he's like, I've met him, he's a good doctor, let me send you to him. And my chiropractor set me up to him, and the day I saw him was the day I scheduled my appointment.
The treatment I had was a cervical fusion 3 through 7, and then I was also having lower back pain, so they noticed degenerative disc between the L5 and S1 area. So basically all that needed to be repaired. He also suggested a second opinion if I needed it, which made me feel more comfortable. It's like if you're willing to say, hey, go ask somebody else, they'll tell you the same thing, then I just feel comfortable with stuff like that.
I can do just about anything I want to do. I have no pain at all. I still have 85% range of motion in my neck and 85% range of motion in my low back.
Since the surgery, I've actually lost 40 pounds. I've basically gained about 10 of that back, but I've maintained that. I've started working out. I'm up to riding about 3 times a week, 50 miles on my bicycle, which contributed to the weight loss, obviously. My whole quality of life has just totally improved. My outlook on life is great. I just felt like in the beginning that when I was feeling all these chronic pains, that was just part of getting old, and that was totally not true.
Since my surgery, I can sleep. I can sleep on my stomach. I can sleep on my back. I can sleep on my left side, whereas before I could only sleep on my right side. I have no pain. I can ride horses again without days of pain afterward. Ride my mountain bike. I can garden. Yeah, I can do anything. I can wear high heels.